Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hey everybody, welcome back to the podcast. Today's show is sponsored by Health IQ, an insurance company that helps health-conscious people like runners, cyclists, weightlifters, and vegetarians get lower rates on their life insurance. So if you would like to get lower rates on your life insurance, go to healthiq.com/HWS to support the show and to see if you qualify. Like I said last episode, I'm so excited to have them on board. So check them out, see if you qualify for a lower rate. All right, on today's show, I am excited to have Dr. Cheryl Keller Capone on. She received her PhD in biochemistry and molecular biology from Penn State University. In 1999, her graduate research focused on muscle development and differentiation, and during this time was awarded the Paul Berg Prize in Molecular Biology, the Roberts Graduate Fellowship, and the Frederick J. Wedler Outstanding Doctoral Dissertation Award. In 2009, she returned to Penn State and is currently studying blood cell development with an overall research goal of understanding molecular mechanisms of gene regulation in mammals. Outside of the lab, Cheryl is also a former collegiate runner who became interested in strength training and movement following a long history and many years of chronic pain. This experience led her interest in pain science, as well as a certification as a personal trainer through the National Academy of Sports Medicine. And when not in the lab or working with clients, she enjoys strength training, running, hiking, swimming, cycling, and spending time with her husband and son in beautiful State College, Pennsylvania. So, what do we talk about in today's episode? We talk about her journey with chronic pain. So you know, if you've listened to the podcast, I've had a lot of different people on talking about their journeys with chronic pain. And it is real. The struggle is real. So we talk about that. We talk about her catalyst for her road to recovery, implementing the biopsychosocial model and functional movement to combat persistent pain, and her empowering advice for those still experiencing persistent pain. So a huge thanks to Cheryl for sharing her story. I know it's not easy. I have done it in the past a little bit, not really, not as much as she has in this episode. So I want to thank Cheryl so much for coming on and being open and honest, because I know it is not easy. So everyone, thanks so much for tuning in today and enjoy today's episode with Cheryl Keller Capone. Hi, Cheryl. Welcome to the podcast. I'm happy to have you join me.
Hi, Karen. Thank you so much for having me on.
Yeah, and now you've been on a couple of different physical therapy-related podcasts talking about your story with pain. And as you know, I've had a lot of different people come through the podcast talking about their struggles and their victories and their wins and their losses when it comes to more chronic or long-term persistent pain. So I'm really excited to hear your story. So, and with that being said, I will hand over the mic to you and tell us your story.
Great. Well, again, thank you for the opportunity to share my story. I have been on a few other podcasts, as you mentioned, and actually it's been a really learning experience and a cathartic experience, if you will, kind of just by having the opportunity to tell my story, which I think, as you know, can be important for people going through pain, just to make sure that they feel that they're heard. So my pain actually began when I was a child. I had several injuries where I had a problem with my neck, where I turned my head and I couldn't turn it back. And I had some back pain later on when I was a little older, related to some repetitive hyperextension. And at the time, I felt that they were fairly moderate or severe pain. I did not get any treatment for either one of those. I think that as a child, it wasn't really taken seriously. But I learned to adapt and move on with my life, although having pain on and off all the way through high school and college. It didn't really stop me. I ran cross country and track in high school and college competitively for the team. And I continued to run, and I just sort of accepted it as part of who I was, or part of the cards that I were dealt. And it wasn't until after my son was born in 2005. So I always ran, but after my son was born in 2005, I decided when I started back running, I wanted to kind of get back into local racing, like local 5Ks, nothing, real serious. But I started back and everything was going great. I felt pretty good. And then there was sort of the whole minimalist movement in terms of, going more toward these minimalist running shoes and so forth. And at the time I was wearing motion control shoes and orthotics, and I was having some in pain, all the standard, and I'm using in quotes because it's not really very descriptive, but the whole runner's knee and IT band pain. And we know now that's kind of a meaningless term, but that's what I knew it was at the time. So I kind of got rid of the orthotics and the motion control shoes, and everything was going pretty well, except then I had started to develop some both pain and tingling in my feet. And I was like, well, that's a little odd, but I just kept going. I kept running. And oddly enough, my performance continued to improve while my pain continued to get worse. It was really kind of a strange situation. I started seeking some medical care, and I was reassured that there was really nothing wrong. So I kept running. And I kept having more pain. And then some other symptoms kind of started in terms of like more tingling a little bit, numbness. And I came down with a post-tib injury. And at that point, I think was really the start. So that was right about 2009. And that was really kind of the start of sort of my downfall at the time, where I did get care. I did get orthopedic care and physical therapy for the post-tib injury. And it was treated as that, although I felt at the time that was really not the whole story, that there was something else kind of underlying that really wasn't being addressed, but I couldn't put my finger on it. But the care was definitely focused, more on that injury and more of a structural diagnoses. And it's true, I did have swelling and other symptoms consistent with, that injury, but I also had sort of a more broad kind of symptoms as well. And for going through all the exercise program, and I really wasn't any better. And, but I was encouraged to get running, and I'm like, well, okay, something's still wrong. And sure enough, I was back in the orthopedist a couple months later with a tibial stress fracture. So, right away, I'm like, something's going on, something's not right. And I felt that I really wasn't, that they weren't really taking my concerns seriously, or they were not looking at the big picture. And this may not go back to, the fact that, I did have a history of, pain and injuries since I was a child. I am hypermobile. I do meet all those, I can never remember the word. Is it like Brighton and Baton criteria, or whatever those criteria are for, benign hypermobility. So, I've always been kind of a little klutzy, a little difficult to control sometimes, range of motion and so forth. And I'm like, I feel like I'm really struggling here. Something's still not, going well. And, so I was kind of back and forth to a number of different doctors, and I had several rounds of physical therapy. And it seems like each person I talked to was sort of more narrowly focused on one area of the body or the other, where I was claiming pain. And it's true, the pain was kind of getting wider and wider and more broad. And I really felt like, really, this is not helpful. Something someone needs to kind of take a more broad approach. And things got a little worse then, and I started having more widespread pain and more back pain, and then I started having pain in my arm, and then around 2013, so it's been going on for a couple of years, I had another injury where I was outside weeding, and I kind of did, it wasn't like a flexion extension, but it was more of a single arm row with my arm. And at that point, something felt odd. I felt kind of a twist in my sort of mid back, and it was definitely a threat, a perceived threat, at that point. And I didn't feel any pain, but then the next day I woke up and, my whole leg was tingling and numb. And, so I'm back in the orthopedist. And of course, they don't find really anything, just a few MRIs. And, I did have some changes, but, was told it was really not any different than what would be expected for normal age-related changes. I do have a spondy at L4, L5, which I hadn't been aware of, but that may have correlated to the back injury as a child. But again, nothing, there was, imaging, there was no direct, there was nothing that could really correlate and bring everything all together. And that's not surprising looking back. And I wasn't necessarily even expecting any sort of specific diagnosis. In fact, I was actually very frustrated by the fact that individual providers were focusing on one thing or another and trying to pin it down to one particular sort of structural cause, because I felt that none of those that were being offered could provide an explanation for the vast, number of symptoms that I was experiencing. And at that point, things just then really kind of spiraled out of control. I would say it's that where I felt shortly after that injury is where I felt that I kind of crossed over into sort of the central sensitization symptoms, where things really started getting out of control. I was having high blood pressure. I never had high blood pressure in my life. I started having some vision problems. When I turned my head to the right, I would come down with vertigo. I wound up being like nauseous and having mild vertigo for well over a year. So at that point, my nervous system had just decided that it had had enough, and it was really just kind of done. And so that was very stressful, and no doubt, at that point too, I mean, I think there was so many different factors that were kind of playing in, and I was very frustrated that I felt like no one would help me as I went to different clinicians. There mostly was like, well, there's nothing really wrong with you. And I was like, well, something is wrong. Maybe it's not a structural thing, but something is wrong. I need help. And my function really started to decline. I was even having some trouble with like a mild foot drop, where I'd have trouble going upstairs, or I'd be tripping over my feet and going up curbs. So I was having not just pain, but actually some functional problems too. And then the numbness too, which it was for me an indication. Well, yes, there were some central symptoms, but there were also some more biomechanical issues going on as well. Because it was, like I said, it wasn't just pain, but it was also some numbness and tingling, but it got to be very scary at that point, where I felt like it was such a vast array of symptoms. And I went to my primary care, and at one point they even did a brain scan to look for MS. And, I thought because this is getting like really out of control. I was having trouble, a little bit, not trouble walking to the point where I actually needed physical like assistance to walk, but I felt like I was dragging my right leg behind me. Like I wasn't coming through normally during swing phase. I kind of felt like that was something was kind of not working correctly. And in hindsight, I think that, it was essentially a lot of different compensations and adaptations that were, leading toward altered motor patterns and altered biomechanics. And I think that, my body adapted as much as it could. And then it just said, that's it, we're done. Your nervous system and everything is not able to handle this level of stress. And I don't want to be dramatic and be inappropriate and say things shut down, because that's not scientifically correct. But I think that I was compensating, and I could no longer, my body could no longer compensate. I felt like I was losing the ability to control my body in a way, like in a functional way. And, I felt like I couldn't really communicate that. And because I had really in general a pretty, very healthy lifestyle. I mean, I was a runner and, I looked fit, and they'd ask me questions about my nutrition, and all my blood work would come back okay. And they're like, well, there's really nothing wrong. I'm like, well, something is wrong, So I finally kind of was at rock bottom. I really felt like I had no idea what to do. And I ran into a physical therapist, the fall of 2013-ish or so.
Yeah. And now this is 8 years then after you had your child and started running again in 2005. Aside from pain that you'd had in childhood and then through adolescence, so you're talking 8 years, 2005 to 2013, 2014, right? I mean, that's a long time.
Well,
it's no wonder you were anxious and frustrated. And
yeah, actually, I think I didn't really start having too many problems, I would say, until 2008-ish.
Mm-hmm.
And then 2009 is really when I, stopped wearing the orthotics and things started going downhill. But yeah, this was ongoing for years.
Yeah.
And the thing is I kept running. I'm a runner, and runners like to run.
Yes.
And I actually didn't feel that I was, no doubt that there was, fear avoidance with certain patterns and movement. And I'm not denying that. But in general, I lived my whole life with some sort of pain, and, usually just kept going because I liked to run. So I would just do it. But I actually had to stop after a while because I was actually like limp running, which was I decided it was just stupid. And, I was not really helping myself at that point.
Yeah. You're not really serving yourself in a positive way at that point, right?
Yeah, right. Exactly. I mean, it was increasing my pain every time I went out. And what I kept doing it is because I really wanted to hold on to the emotional and social aspect of running, where I had my friends and I wanted to do this, and this is what I did, and my identity. So I actually tried to hold on to that as long as I possibly could. In a way, I felt I was giving up.
Absolutely. Absolutely. And I don't think that that's uncommon in any way. I think a lot of people that are living with persistent pain, they don't want to let go of those things that make them feel normal, because you don't want your new normal to be not doing the things that you really love to do.
Yes, exactly. And that's difficult too. And I also, and I had recognized, I'm like, wow, I wasn't, at that time, I wasn't even 40 years old. And I thought, I cannot live the rest of my life like this. This is not, and I never was at the point where I, felt that I considered suicide or any, I was not there, but I said, I cannot do this. I cannot live out my life this way. Something has to change.
Yeah. And so then
I need help.
Yeah. What was that change?
Yeah, so,
what did you seek out?
So I happened to run into this physical therapist that I knew. And ironically, he was the same physical therapist who had treated me for the post-hip injury several years earlier, except he had left to start his own practice. And although it didn't really help me with the underlying problem at that time, he had started a cash PT business. And I kind of felt at that point that I had pretty much exhausted my what I could go through for the standard medical route where I'm getting insurance coverage and this and that. They basically were like, well, there's nothing more we can do for you. I had tried a few injections and none of that worked, of course. Anyway, so I ran into him, and so he started a cash PT business, and I thought, okay, great. Then I actually looked at that as an opportunity because I felt that not having to deal with insurance was actually, sort of a blessing in that respect. Now, I was lucky that financially I was able to go that route, and not everyone has that opportunity. But, I saw him and I said, I'm a mess here. Help me, please. And so, he said, look, I don't know what's going on, and, but we're going to work through it together. And even the most complex cases, we can make progress if we just kind of take it slow and move forward. And, I felt really reassured by that, because after seeing so many different people who, thought they knew what was wrong with me, and then I failed their treatment and was kind of blame the patient sort of thing. This was a very refreshing response to me. And, he said, look, this is what he's like, I don't know what exactly we're going to do, but my overall plan is we're going to calm the nervous system, and then we're going to slowly work on function. And I thought, perfect. I was really still stressed at the time, of course, but this seemed like a fantastic idea for me. I was actually not really seeking I think I was going to say a structural diagnosis, because, I was already had accepted the fact that there was something more broad. There was a more broad picture kind of going on, and many different factors were at play. But it seemed that until I started seeing him, I don't think that anyone else really sort of recognized that approach. And, this was back in 5 years ago. So I think things are changing now in recognition of the BPS model and so forth.
I
but
agree with that.
but I think that it wasn't really there at that time, or it wasn't, as many people weren't really recognizing that as a treatment model or guideline. So, and that's essentially what we did. The very first thing, of course, and he was trained as a orthopedic manual therapist, and we kind of spent about, sort of an hour like every week, and we spent kind of the first half hour with little manual therapy, which I know there's some controversy about. Personally, I found it really helpful.
I look at it this way. You do the right treatment, what you feel is the right or the best treatment for that patient at that time. And if that means that you're putting your hands on someone and that you're guiding them, or you're doing some assisted stretching or what have you, if it's what you feel is the best treatment for the patient at that time, and the patient has a positive response to that treatment, then great. If they don't,
exactly,
it's not the right thing. I've had patients with CRPS who are like, I don't even want you to be within 2 feet of me. So
sure.
in their space. So I don't, and to do manual therapy on someone like that would be disastrous. So I agree. It's the right patient, the right time, the right treatment, and it has to be individualized.
And on that note, we're going to take a quick break to hear from our sponsor, Health IQ. Health IQ uses science and data to secure lower rates on life insurance for health-conscious people like runners, cyclists, strength trainers, and more. Like saving money on your car insurance for being a good driver, Health IQ saves you money on your life insurance for living a health-conscious lifestyle. These savings are exclusive to Health IQ, and you must qualify to get the special rate. To see if you qualify, get your free quote today at healthiq.com/HWS.
Agree. But you have to kind of get yourself to a point where you have enough strength to then, or coordination or motor patterning or movement competency, right, in order to go that direction.
Yeah.
There's,
sure.
So that's, and I think that, that was an important, switch point, I think, for me too, to recognize that I was going to have to own this. I was going to have to own my pain and own my recovery and be responsible, right? So of course I did get help both from the physical therapist and actually from a chiropractor. But in the end, I felt that, I was going to take responsibility, and I was going to have to, really, really, really own my situation and say, I'm going to continue to improve myself. And I still honestly still do that. I have yet to be able to do a full pull-up by myself, but I feel like,
please, neither do I.
I'm going to work towards that. I'm going to do that, and I'm going to improve, my strength and my ability. And I figure, I'm 46 years old now, but I feel stronger and more confident in my body than I have in many, many years, really. Maybe all my life that I can remember, to be honest. I mean, I'm not as fast as I was when I was 20, but, I feel amazing now, relatively speaking. So,
yeah. And that's and that is amazing, and I love the fact that you said, like, I'm going to take ownership and responsibility for myself and my recovery. And what that tells me is that you certainly have a good team around you that's empowering you versus making you dependent on them. And that's a big difference there.
Yeah, well, I think one of the most helpful phrases that this physical therapist said to me, and this was early on, not necessarily like the first visit or two, but, once we kind of established a good rapport, and he, he had said, what? He said, Cheryl, I don't see anything that would preclude a full recovery. So he wasn't really saying that it was going to be easy or that it was going to be quick, but he was telling me that there was nothing, no red flags or that he thought that I couldn't overcome. And that was such a powerful phrase for me, because at the time I don't think I quite appreciated it, but I held on to that. And even when I had some doubts, and there were definitely times where I was doubting or more confident, and there's that roller coaster, but I thought, okay, if there's really nothing that I can't get by, then I'm going to keep working toward it. It's not going to be easy. It's not going to be fast. It took a few years, but hey, I've done a triathlon, right? So in this past June, and I ran my first 5K just a few weeks ago, and that's the first 5K I've done since 2009. So I feel like I did make it back. Woohoo!
Yeah, what a great feeling that must have been when you crossed the finish line.
Yeah, I honestly had thought to the point where I don't know if I'll ever run again. Which was actually psychologically, right? That was a big thing to deal with. Although interestingly, once I got into the strength training, and although I had resisted that most of my life as being a runner and everything, but once I actually got into the strength training and saw what strength training can do, both from a physical strength standpoint as well as just the effect on the nervous system itself, I had decided that if I had to choose between the two, I would choose strength training, as much as I had always identified as a runner, because I felt like the strength training had such a positive difference, on my life. But when I actually got to the point where I'm, actually back and running, it's like an amazing experience. And I feel like I really try to appreciate it, every time I'm out there.
That's awesome. And now, from your point of view and your recovery and the time that you spent down with persistent pain to where you are now, if you were to give advice to someone who's maybe in the weeds right now, they're having this chronic pain, what advice would you give them?
Now, I would say that there is most likely a path forward for everyone. And, you really just have to find the right person who can work with you, to help you with your journey. But I think that's really, not everyone's taking the same path, right? And there might be rocks in your path or dense bush, whatever, that you have to, cut down as you go through. But in general, there's probably a path forward. And I think that you just gotta, take ownership of your own path. Of course, help along the way, but that's where I would, yeah.
And now that you aren't experiencing a lot of the symptoms that you were experiencing back at the peak of your sort of persistent pain journey, do you still feel like you're waiting for the other shoe to drop? Like, oh, I have to be careful doing X, Y, and Z because the pain could come back? Or do you feel like you're beyond that and you're really in the place now where that's not even in the back of your mind?
That's a really good question. I have sort of two different things I think to say about that. First is that I think that although we don't necessarily want to blame pain on necessarily, structural issues, I do have this spondy, and when I sleep currently, even when I sleep in a bed in which my pelvis sinks down, where it would put me in a lot of extension, I can sometimes still wake up with some numbness in my legs. Mm-hmm. And whether or not that's due to the spondy, I honestly don't know. But so that's something that I think I am careful about, and that I may need to just be careful about that. If it's sometimes I'll just even put a little bit of a pillow or a folded towel underneath my pelvis just to stay neutral. So I think that, for me, there is perhaps some, mechanical thing that might be still a factor, but, which then comes up on travel and so forth. But in general, I don't really let it bother me. I recognize now that can happen if I sleep in a really soft bed. So I either avoid it, or if I wake up with some numbness, then I just recognize that and make adjustment for the next night, and it's fine. So, that I guess psychologically I've learned to just say, okay, no big deal. That happened, and it only really happens in that situation. So I'm good. I also during this whole recovery, the physical therapist had encouraged me to get my certification as a personal trainer, which I really just kind of do more of as a hobby. But I did learn a lot about exercise and exercise progression. And certainly I'm, not an expert on pain and injury. But, if I'm having some, little discomfort here and there, I will think about the exercises that I'm doing and just maybe make an adjustment. And I feel that I continue to make progress. So I do still put a fair amount of time in. I'm not concerned that all of a sudden something is going to come rushing back and I'm going to be back in the throes of chronic pain. That is really not a concern. But I also don't expect that I'll never have any pain again. Mm-hmm. But I feel like now I'm in a position where if something comes up, I can kind of figure out, what to do about it. And I mean, if I really need to see a clinician, I would, go see someone. But for the most part, I kind of address these little things as they come up along the way, and I'm good. So I feel pretty confident. I feel like my function continues to improve. I feel like my performance in running, cycling, and swimming continues to improve. And by continuing to focusing on function, I feel that's been a good guide for me. And so I feel pretty recovered.
I think that's great. And now before we end, I just have one more question. That's the question I ask everyone. And that is, what advice, knowing where you are now in your life and in your career, what advice would you give to your younger self?
I think it's important to be aware of your biases. I think that both as a runner, as a patient, and as a researcher, because I am a scientist, I think that when I was younger, I was not aware as much of bias. And of course, we are all biased because we're human. So that's a normal human condition. But I think being aware of your bias and recognizing that theories and hypotheses change as new evidence develops. So, never be too tied to or invested in any one particular hypothesis, if you will. So try to be open to evidence, essentially, is I think would be my advice.
I think that's great advice, and one that a lot of people I think can take advantage of. But I want to thank you for coming on and kind of sharing your experience. And, you now feel like you have the tools that if something comes up, an ache or a pain, that you have the tools that you yourself can now kind of take care of yourself and own your body and take responsibility for it. And I think that is a great outcome for someone who had lived so long with persistent pain. So I just want to thank you for sharing all of that and for coming on the podcast.
Well, thank you for having me and for giving me this opportunity. And I always enjoy, talking to new people and to different physical therapists and to really have the opportunity to share my story with everyone. So thank you very much, Karen.
If people have questions for you, where can they find you?
Probably the easiest place would be Twitter. I am on there probably more than several times a day.
Uh-huh.
So I'm on it. Yeah, I'm on it. Keller Capone, PhD, and that's my my Twitter handle. So that would be a good place probably to get in touch with me.
Great. And we will have a link to that in the show notes under this episode at podcast.healthywealthysmart.com. So again, a huge thank you to Cheryl for coming on and being brave and sharing her story, because coming from experience, I know it's not easy. So thank you again to Cheryl, and thanks to all of you for tuning in and listening. Have a great couple days and stay healthy, wealthy, and smart.
Thanks again to Cheryl and to the sponsor for today's podcast, Health IQ. They are an insurance company that helps health-conscious people like runners, cyclists, weightlifters, vegetarians, and hopefully physical therapists get lower rates on their life insurance. To see if you qualify, get your free quote today at healthiq.com/HWS. So big thank you to Health IQ, and thank you all for listening.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.